Hello to our Support Fibro and Looms for Lupus friends. Welcome to a very special Community Connect all about May Awareness and Advocacy. I'm joining in with my favorite teammates, Looms for Lupus, so I'm going to let them introduce themselves and we'll get this party started.
Hi, good morning, everyone. I am Estela Mata. I'm one of the co-founders of Looms For Lupus, a nonprofit organization that was formed by my sisters and I to support those living with lupus and overlapping conditions such as fibromyalgia and their loved ones and caregivers. So we're excited to be here again this Friday on a Community Connect Live with Melissa from Support Fibro.
Good morning, everyone. I'm Juana Mata. I'm the other co-founder of Looms for Lupus, and I was also diagnosed with lupus in 2009, and we're excited to be here in our Community Connect.
Yeah, this is a special broadcast of Community Connect as we bring it in. So everyone, I'm Melissa Talwar from the Support Fibromyalgia Network and excited to be here connecting with our community. Please let us know where you're tuning in from by leaving comments. This is going to be all on participation. Ask your questions. Get ready for May. Little insight into what's going on. So let us know where you're tuning in from. And if you know where to get better sleep, please post that in the comments as well, because we need as much sleep as possible coming up and how to be our best selves as we move into May. But one of the big topics that we always talk about is community here. So I bring this up in the first part of this conversation because it's a huge deal, working together and what we need to accomplish. Like, we need to accomplish advocacy efforts and awareness, working on proclamations, getting our legislators together, being the best health advocates. So how do we accomplish working together and building a better community? I'm kind of opening it up to Juana and Estela as we brainstorm a little bit, but we definitely want to hear from all of you out there. So what's your vision of community? And how do you see it? What aspects of community do you like? What would you like to see more of? Let's share our vision of a community when it comes to lupus or fibromyalgia, or lupus and fibromyalgia communities working together.
Well, for me, Melissa, I think, one of the reasons we started this, or your idea about having these Community Connect Lives every week, was about connecting the community, connecting the different conditions that have been separated by, well, I only raise awareness for fibromyalgia because that's what I have and that's what my loved ones have. Or I support only, lupus, or I only support this. It's not about just one. I think it's better. And I think we saw it more with the pandemic. A lot of things do impact all of us across the board. So when we have all these silos and all these people working separately, you don't see a lot of difference or a shift into what your goals are or what's best for our communities. And I think coming together, we form a better team, right? So the more ideas we have, the more effective, creative ideas we have, the more efficient we're going to be. And at the end of the day, our goal is to continue living and thriving with these conditions that sometimes limit us, and also empowering each other to share our stories and to let others know that they're not alone. And not only that, but a lot of the issues that we face are about healthcare, about our well-being, about our mental health. And those are things that are not isolated to one specific group. So for me, community is coming all together, despite of whatever condition you may have, learning from each other, learning about other conditions and how it impacts the other person, learning about being empathetic and working together. That to me is community.
Estela said it all, but yeah, absolutely. Just coming together, learning from each other, and as a community, just learning and coming together and helping each other. That's what it's all about. And we don't have to necessarily have a condition to be there and support others, but just the fact that you can be there, I can be there, and just the support from one another, knowing that we are not alone. That's community for me.
Exactly. And we have David tuning in too from the UK, and he says totally agree, Estella. So we have projects with David coming up, and I know we did a Twitter project so with rare diseases. So this is all this aspect of, coming together and working together, because we all have really similar goals when we look at it, despite what we're diagnosed with. I mean, we can take this opportunity, like you've incorporated me into, is like healthcare advocacy. We can talk about sleep. We can talk about nutrition, just patient education, healthcare education for medical providers, because many of us still have the same struggles with communicating for our medical providers. And even research ends. There's so much that overlaps with each other. So it's like, why not take a more aspect of working together rather than competitive? And it's like, we're not competing. We want the same things for our communities. And so I should definitely share that link with Simon Sinek, because that resonated with me so much. I think I shared it with all of you guys. The 4 impact organizations, like, we're for impact, but why are we not working together? Because we're here to improve all our lives together. So let's team up and solve problems together, because we're playing off all our strengths. So each of us have our own strengths, and we bring them all to the table and we tackle these issues, and we can actually get a lot more done when we do this. So why are we separating from each other? And that's the big point of all of this, of what we're doing in May. So I'm so excited to be working with you guys about all the May awareness.
Yeah, and not only that, not only just highlighting our strengths, and we're not all experts at one thing. And I think, that's why there's teams, right? Because one can't do something that the other can, and sometimes you can't do it all. So it's not about competition, it's about working together, and it's about just unity in the community, and that's really what it's about. But yeah, it's so interesting that we have come so far with just this Community Connect Live, Melissa, because we have crossed over, we have highlighted so many organizations that are doing the impact in their community and across the board. Just having David tune in today, it's a great example of the unity amongst so many people. He's in the UK, we are here in the US, but yet we're able to work together, and we're able to amplify each other's voice and raise the concerns and hopefully come up with solutions. And I may not have all the solutions to a lot of the questions or issues that he may have, and he might not have them for me either. But together, maybe if we share our ideas or questions, people will come and join us in this venture. So, I'm glad that David is tuning in. And yes, it's so great to be able to work with him in the rare disease community, and also for him to work with us, because it's pretty amazing. He has a mental health support group, and he also is doing the same thing. He started doing this community where he's with different men from different conditions. They're just men with a mental health support group. And it's pretty amazing what he's doing. So, again, kudos to everyone that's taking that leap and making this happen. And thank you, Melissa, for having this Community Connect Live to allow and embrace other communities to come together and join us with all the efforts that we're doing. And I know May is coming up, and I know we're focusing on May, which is, Lupus Awareness Month. It is Mental Health Awareness Month, and it's Fibromyalgia Awareness Month. And I believe May 23rd is MS Awareness Day. So we have a lot of things to support, and I believe it's Lyme disease awareness month as well, and MECFS. So imagine all of us working together, trying to get our voices heard, amplifying and raising awareness for the conditions and for each other's conditions. So it's pretty amazing what we can do together as a team. So, we're going to talk about proclamation. So if you want to just go over really quick what a proclamation is, Melissa, and then we'll just get started with what we're doing in the month of May. But we need to get started now.
Yes. Oh, there's that. Um, yeah, I mean, let's give a shout out to some of our people that are tuning in. So, hi, Amy from Baltimore. So, we just highlighted David. He's been chiming in too about unity and community. We have Julie from Minnesota. So, it's great to see everyone here. Please be sure to let us know where you're tuning in from. And then also, if you have a vision of community and what community looks like, please add that in. So, through unity, bring support and hopefully change for the better. Exactly, David. So we appreciate you. We can't wait to work with you more. Oh, there's Karen, North Carolina in the house. I love that. So we look forward to working with North Carolina more in the coming months. And so one of the things we are working on together, which I'm excited about, is bringing our groups together to do proclamations. And we have two of our amazing experts right in front of me that helped make that happen too, which was just amazing last year to watch and see. And I've seen them through the years do the same type of sharing. So it's kind of like a coalition of sorts that we're doing. But a proclamation is a ceremonial document issued by the city council to commemorate a specific time period. So either a day, week, or month for the purpose of raising awareness about local efforts. So in this case, we're going to be talking about lupus, fibromyalgia, mental health, and then we've even included some Lyme warriors in the workshop we're hosting and stuff like that as well. So I will let you guys take it away on the proclamations.
Yes, should we start by saying that on tomorrow, we're actually going to be having a Zoom meeting or a Zoom call to talk about the proclamations, talk about what the process is, give you ideas and tips on how to get started, and also provide you with the tools that you need to request a proclamation so you can raise awareness for the specific condition that you want to raise awareness in your city. The goal of this is to amplify our voice, to amplify the voice in your communities. And just here, looking at the people that are logged in right now, people from Minnesota, the UK, North Carolina, and, I know Lupus Booms is always here from Chicago. So there's so many people that we reach out to. So just imagine having the US like all over, like in a map, and having different cities lit up or different states lit up, indicating all of the work that we have been doing together in the community for the month of May. So for example, we do a proclamation here in California, someone does one in Georgia, Minnesota, North Carolina, and Melissa is going to bring all those up. She's going to highlight everything that we've done, and we will be able to see the big picture of what everyone individually has been doing in their cities or in their state, and we will be able to see the work that we have done together. So we are hoping that many of you join us on Saturday. If you don't have the Zoom details, let us know. We will send them to you. But again, May is Awareness Month for lupus, fibromyalgia, Lyme disease, and I forgot the other one, Melissa. I forgot the other one.
Mental health.
Mental health, and there was one.
It's MECFS, and it's, yeah.
Okay, there goes my fiber fog. So you see why we need to be a team, we need to be a community, because if we don't all have the answers, if we need help, we can just count on our partners to help us out. That's really what it is about. So we are going to be talking about the process, and I will tell you, I usually help out with a lot of the logistics, like the writing of the steps and stuff, but really the one that does all the work behind the scenes and calling and asking for the proclamations is Juana. So what I'll do right now is I'll just let you know that it's something we need to get started, and then I'll have her kind of talk about the process. We have to get started now because some cities and some states require 4 to 6 weeks of requesting the proclamation. And basically the proclamation is just a document indicating that they are proclaiming or declaring the month of May as Awareness Month for the specific condition, and someone goes and accepts either the proclamation from the city. Usually it's in person, but with COVID, most likely we're going to get them mailed again. Once we get them, then we are going to share them with the team here, Melissa, Juana, or I. And then Melissa is going to start highlighting and working on the map to show everyone the accomplishments that we have been doing. So want to go ahead and just explain the steps to requesting the proclamation.
Well, it's not that difficult. What I started doing, or the steps are usually, is to call the city clerk. And from there, some cities will give you something in writing that you have to complete and send the information as to the proclamation. Other cities, you just send a copy of the proclamation that you won. They will review it and they will edit some things if they feel that they shouldn't be there. I've had that happen in several cities, but basically it's just calling the city clerk and just following their protocol as to what needs to be done. Usually it's just sending an email, completing a form, and they will move forward. They will ask whether you want to be present back 2 years ago, whether you wanted to be present or you wanted the proclamation to be mailed to you. Usually before the pandemic, our lupus warriors, lupus patients would go receive the proclamations with Looms For Lupus in our local cities. And but after the pandemic last year, we started receiving them by mail. And that would be the only way, though. They do present the proclamation during a city council meeting. And last year it was presented through their Zoom. So they were still presented in their city council meetings, but we couldn't be present. So they would mail the proclamations to us. But it's very simple. Just, calling the city clerk, and that's about it.
Yes, and it's so important to follow up. So you make the call, like Juana said, step one, you make the call. Number two, you send an email and follow the process. So if there's a form or there is an email format that you have to send, you do that. Number three, you follow up. If you don't hear back from them, then that means they're either in the process or maybe they didn't receive your email. So it's good to follow up. So call, send an email, follow up. Once you get the proclamation and they approve it, and they tell you, okay, we're going to mail it to you, and this is the date of the Zoom if you want to join the Zoom. Obviously, if they give you Zoom information for the meeting, then you can take a picture or do something and then let us know, and also share it on social media. You want to publicize this. You want to make it a big deal, because guess what? It's a big deal. So you want to go ahead and amplify that, share it in social media, make sure to tag us, and then we will also share it. So again, it's not about, oh, you tag us because we want credit. No, that's not what it's about. It's about community. It's about we help you and help you do the steps and give you a format for the proclamation. We help you and assist you in the process. Then you do the work and then you follow up. Then if you need help, you call us. Once you get the proclamation, you share it, you tag us. We know that you have sent it out or put it out on social media, and we will then share it. And we will also be putting it on that map that Melissa's going to be creating, and everyone's going to see the effort. So it's not about giving anyone credit. The person that's going to be getting the credit is you, because you're going to be doing the work, and we are going to be so grateful for you joining the team. And again, it's not about joining this team or another team. It's about working together and amplifying the voice. At the end of the day, when that city and that mayor and that clerk hear about what you're doing, they now know about this condition that you're raising awareness. Then when they talk about it in their city meeting, city council meeting, then guess what? The people that are in that meeting now know and understand a little bit more about that condition. Then they go home and they share it with their family or their other people that they know, their neighbors. And then guess what? You have raised awareness. So it's pretty amazing the ripple effect that all this makes. So proclamations are the ripple effect of what you have been doing in your city. So it's just pretty amazing to do that. So those are the steps. Pretty easy. If you need help, let us know. If you want to join our Zoom meeting tomorrow, just send us a message and we will get that information to you.
And most importantly, by doing the proclamation, also, not only you're raising awareness, but you don't know who you're helping out there. There's, in our community, especially in the Hispanic community, I know that just when somebody talks about lupus or fibromyalgia or mental health, it's important for us. So yes, you never know who you're going to touch in that city council meeting via Zoom now, and you're helping others. So that's important.
Exactly. I mean, when we talk about public awareness isn't just about education on the specific illness, but this is the aspect of public awareness that we need. And then you're integrating more of the community aspects in your local community. And like you mentioned, you don't know who is in your community that might be diagnosed with this. And so you're representing them and you're sharing with them and hopefully giving them more of this empowerment too, that, oh my goodness, there's someone in my community that understands me. I'm not alone. And then, you never know what can even come from that. Or you don't even know if someone who's actually on the boards of these communities might be diagnosed with that and they haven't even shared their story yet. So we're all coming together. This is the top net of public awareness and bringing that to your own local community and even state level, because you've also worked on state level proclamations as well, correct?
Yes, we have. We have requested proclamations at the state level. We've obtained them the last, I believe, 3 years with other organizations. So again, it's about seeing how you can work together. Obviously, not everyone can get that proclamation. So we try to include as many organizations as we can to participate in that effort for the state level. But, obviously the community level, if you live in the city, you just let them know that you're a constituent and you matter. And again, don't feel like, okay, you know what, it's just me, like I can't do this. You can go ahead and do this. But yes, we've done it at the city level. We've obtained up to 19. And I say we because it's about the community, each community. So if someone from Fontana, someone from San Bernardino, someone from, West Covina would come to our support groups, or if we knew someone in the community there that had lupus, we would request these proclamations. So it's been pretty amazing to see the impact that we have. And then we would invite everyone to come to accept those proclamations. So these proclamations are not for us, they're for the community. But that is one of the things that I love about this, Melissa, is because you're highlighting like the efforts that we could do as far as raising awareness and advocating, not just for ourselves, but for our community, in our community through those proclamations. But another thing that we have done is obviously request proclamations at the state level. And we also have been doing legislative advocacy. So a lot of the work that is done doesn't just happen like the month of May. It's throughout the year. So you want to continue to raise awareness throughout the whole year. In March, for example, we attended the virtual legislative advocacy efforts with the Lupus Research Alliance. And we have been doing this for 3 years already. I think this is our 4th year. And in the past, we would go to Washington, D.C. I know not everyone can. However, we would bring it back and we would empower everyone to go ahead and communicate to your legislators locally and at the state levels, to let them know that you are supporting these efforts. And what that is about increasing funding for the diseases or the conditions. So for example, for lupus, on March 15th to March 19th, we did it all virtually from the comfort of our couch, our bed, or wherever we were at. And what we did is we heard from other advocates through the Lupus Research Alliance. They had a virtual symposium. We heard from advocates that have been in the Hill. I was one of them, yay, and I was able to share my story about what we do when we're there and what we do continue to do when we come back from DC, right? So one of the things that we do is share our story. How does lupus impact you? How does it impact your community? Because at the end of the day, and I'll give you an example. My sister Juana has lupus. She's also a children and family service social worker. If she is ill, if there are no treatments for her, then she can't then work as a social worker. And she then, it's again a ripple effect. But in this in this case, it would be negative. It would impact the children and families in the community. So those are the things that you want to share with the legislators. Every story is different and every story matters. So we share our story so we can raise awareness about the condition and how it impacts our communities. After we do that, we ask for the funding, increase of funding. So in March, what we did is we asked for funding for the lupus research program under the Defense of Health program to increase to 15 million. Now, I'll just tell you, in 2017 was when the lupus research program started with the Department of Defense. It didn't exist before. And the reason it exists now is because people were talking about it and people needed to have them hear the importance of this. So they allocated, or they created, the Department of Defense, a specific lupus research program, and they allocated, I think the first year, 5 million. Then it increased to 10 million. And now we are asking for the program to increase to 15 million. The second ask was for the Department of the National Institute of Health. So usually there's so much money that goes in there, and then they get they allocate the funding to different diseases or different groups, right? So we are asking for the Department of the National Institute of Health to increase it to at least 46 billion. And I believe it was up to 44 or 45 last year. So we are asking for an increase. So those are the things, and really the goal of amplifying your voice, whether it's at the community level, asking for proclamations, whether it's talking to your neighbor about it, whether it's at the state level and asking for a proclamation, talking to your legislators, or going all the way to emailing or calling your congresswoman or your congressman and your senators. Because, as you know, like right now, Vice President Kamala Harris, her sister has lupus. We didn't know it. We had been going to her office to ask her to support the lupus initiatives. And little did we know that her sister had lupus. So like Melissa said, you never know who you're going to touch. You never know if these people are living with the conditions, because guess what? They are people just like us. So they just need to be informed. And that's all we're doing. We're informing, raising awareness, and then asking for assistance or help.
I mean, that's just incredible overview of what you guys have put together. And that's what's inspired, I know, myself and others in the community to do more, and how you got involved. Because this is where it's like, I know there's a disconnect with understanding of what we can do, because we're like, oh, we're just patients, right? But that's nothing of like, we aren't just patients. This is up to us. And especially as I do a call to action to all my fibromyalgia warriors, please don't discount who you are. It's going to be up to us. And as I learned from all these communities, especially when it comes to working with the DoD, like I know Juana was on the committee for a peer review. Do you want to share a little bit about that? Because what I'm trying to do is get patients to understand these different opportunities, because I think we always think it's someone else, even for research. Like we can't do that because we're just patients. That's what we use, but that's not true.
Absolutely, it's not true. And it was such an honor to be selected to be a peer reviewer. And I mean, it is it's obviously confidential information, and we are not allowed to say anything about what's going in there or what studies or what is going to be, what's coming from scientists. So it was very interesting. And like I said, it was an honor to be part of the DoD, and just being a patient peer reviewer is important, because now we see that the DoD is also considering and seeking the help from patients, because we do have a voice. So that's important. So I was very honored to be there. And I mean, I can't really say enough other than, I was grateful and happy to know that the patients' voice are being heard. And that's what I can say.
Yeah, and it's so important to know that back in the day, you would think like, if you asked us 10 years ago, did you see yourself going to share your story in DC, being a reviewer, a peer reviewer for, and sitting along the table with other scientists and reviewing a lot of the stuff that you were reviewing, sister. And again, I know you can't say much, but would you have thought that you were going to be able to do everything that you've been doing, traveling to DC, talking to legislators, sharing your voice, reviewing things like that, and getting proclamations, even getting Woman of the Year for the work that you're doing at the community level? Did you ever think that you could do that?
See, that's one of the things that I always say, that yes, I have lupus and I hate the fact that I have lupus, or I actually don't hate it. I'm wasn't happy that I was diagnosed with lupus, but one of the things that I have to say is that with lupus, great things came. Yes, I could be in pain, but I know that I am doing whatever I can to touch others, to help others, to bring awareness. So lupus has brought me a lot of great things and has given me the opportunity to do a lot of things that I never in my life thought that I would have been able to do. And with lupus came a lot great things for me, and the opportunity to do things that I would have never done if I wasn't diagnosed with lupus.
Yes. And that's really what we want to share with you, is despite of, where you're at today, what you're doing right now, if you get a diagnosis that is life-changing, a chronic condition that you may be struggling with, maybe you haven't even been diagnosed, but working together and helping someone else is probably the biggest reward I think that I can imagine. It was devastating to hear when you were diagnosed, sister. You almost lost your life. We didn't want anyone to go through what we were going through. And that's why we started doing what we do. And we didn't just take it for us to do the things that we have been doing. We have been advocating locally at the state level. We support caregivers. We try to help in any way that we can, and we work with other communities. But I think the most important thing is we empower other people. We don't just keep it for ourselves, and we don't want to take full credit for everything. A lot of people have helped us along the way. We wouldn't have known what we know now 10 years ago.
Exactly.
But I can tell you that what we know now is what we share with you. And I think that is what's empowering, is the giving back, and that keep that momentum going. Keep supporting others. Go ahead, sister. You were going to say something.
Yeah, definitely with a condition. It's not easy. We do have a lot of struggles, and we are not perfect, and the struggles are real. But again, like Estela said, we from the condition that I was diagnosed with, we used it not in a negative way, but in a positive way, not only to help ourselves, but to give hope and empower others that are going through the same thing. Not necessarily lupus, but like we have been saying, it's not only about one condition, it's about all the conditions, about empowerment and just helping each other. I think that's the main thing.
Exactly. And Kelly is here. Hi, Kelly. And just how to use these platforms to activate change and just bringing us together is so important. And I think that's this is our warrior call here to all the other advocates out there to join. Let's do this. And please don't discount your work, no matter what level you are and what you're doing, because we met so many amazing people, and we still continue to highlight people who put service above self in their communities. And people like the Louisiana Lupus Foundation, Crowning Lupus, they're all working hard to build up that community. And this is all around the country, no matter what, and all around the world. If you're running a support group right now, you're serving the community, and you can share the story of the people people that you're serving. So never discount all this momentum that we have, and utilize our community to like lean on, empower yourself, and gain the knowledge that you want, because it's so important as we move into, I mean, it's weird always just highlighting 1 month, because we do this all year long. Like, we don't stop. We don't just shut down. It's always constantly like on our mind. And I think those of us that know this and run organs like Kelly, like, we are always on. And how do we just keep moving forward one step at a time, just moving forward? So, and I think it's nice that we can all come together and do this together as well.
Definitely. And you don't have to have an organization to do any of the work that we're talking about. It's about you and just speaking out, and you don't have to do it alone. And that's the important thing. But yeah, fibromyalgia, May 11th. Well, May 11th is Fibromyalgia Awareness Day, right? So
No, okay. So May 12th is Awareness Day. But what we're doing, and we're adding in, like, me, I always like to like make sure to see what we can like test with the community, is the virtual fibromyalgia advocacy day. So this is the day, and I know there's a lot of mission behind this when it comes to what we want to accomplish. So I think if anyone's out there, you've seen what the lupus community is doing, what MS does, what Lyme. So fibromyalgia, we need to get in the game. And so this is us getting in the game when it comes to the NIH and asking for more research. This is what we're doing when we're coming to sharing our stories, letting our representatives know what fibromyalgia is and how it affects our quality of life. Because I think what we've learned a few times that we've been there is there's a misconception that it's just like, it's a little bit minimized when it's all encompassing, like pain, fatigue, all this stuff that's like unrefreshed sleep, but also a family component. There's a lot of overlapping with like family members as well. Is there a genetic component? We're talking about neuroinflammation. And I know we have not updated our representatives as much as we should. So we're going to be tackling this all together with virtual meetings. It's the first time we're doing it virtual, but I think it's a great opportunity for those who weren't able to travel to DC, or it's difficult and expensive to travel to DC, that you can get involved now virtually. And we're helping set up meetings for you. So people that are interested, reach out. It's going to be a full day. We're going off of East Coast time. So we'll have different opportunities for people to, if they want to do it before work, after work, during work. But if there's people out there we will love who can actually dedicate the full day to joining us, we'll make it a great experience. You'll always have a team leader with you, joining you in the meeting. So no experience is required. You will learn what it's like. And a lot of it too is just opening up and sharing with your representatives your experience with fibromyalgia. And then of course there's some asks, but it's going to be, I'm looking forward to the virtual aspect to see if we can really capitalize that and eventually turn it into something more hybrid. So if we are there at Capitol Hill, we can also keep a virtual component going.
So we're going to be doing something similar to what we did in the lupus community for Lupus Research Alliance, except that we are going, obviously we don't have all the major funding or a big sponsor, which is one of the things that's pretty amazing with Lupus Research Alliance is they don't use their money for those things, but they get a sponsor, and it's the PA fund, and they usually fund all that. And obviously we don't have a PA fund, but Melissa is putting all this together, and I think together we could still make a difference. And we're not going to let anything stop us, because we're, even though we're small but mighty, I think it's all grassroots, and a lot of us can actually come together and make a big difference. So let's all get together and start raising awareness and doing all this. Join us with a campaign on May 11th. And I think it's going to be fun. I think it'll be really fun.
And we've been able to get new advocates joining us too. So shout out to Crystal Kent, who I'll have a shout out to. I've got to remember those videos shortly. So Crystal from the Fibromyalgia Pain Chronicles and Veteran Voices for Fibromyalgia will be joining us. the Fibromyalgia Care Society of America. So Millie and team jumped on board. So they'll be joining us May 11th. So we are working to combine people. We reached out to Dr. Lipton at the Frida Center of Fibromyalgia. So count her in. We have other bloggers and advocates, and even we're trying to figure out how to incorporate people from around the world. I mean, now that it's virtual, I'm sure they wouldn't mind someone sitting in. So we have amazing people like Carrie in Taiwan. We have Arushi in India. So they want to see what it's like too for us to engage with our representatives. So we are definitely bringing the fibromyalgia community together. And this is what it's all about. So if you are interested in getting involved, we would love to have you. And again, I see people's hesitancy when I ask them. They're like, and so we're trying to break through some of that hesitancy, because you can do this and we are right there with you. We threw ourselves in.
Yeah, and don't make me say, what do you mean you can't join us? Don't you know me? Don't you love me? I have fibromyalgia. Support me. So, we may not have the conditions, but we can support someone that we love or we care about, or just simply share awareness of the condition so people are aware that it exists. There's already so much confusion with what it is, how it affects us. A lot of people don't know a lot about it. And, we are proof that it exists. It's not just in our head, and it's not just pain like Melissa was talking about. It is more than just that. And it does impact the community. So it's, join us, even if you don't have fibromyalgia. But yeah, we're working with so many groups. It's really amazing to see. And a lot of people with lupus, or those living with lupus, have there's a huge overlap of those people that have lupus that also have fibromyalgia. So if you have not been diagnosed with fibromyalgia and you have lupus and you want to join us, hey, you could say a lot of your people that you care about also have this overlap condition. So it's just amazing to be able to help one another. And again, it's about helping each other. And I think it's pretty amazing what you're doing, Melissa. So I'm excited.
May is going to be busy for us, because I mean, we kick off, there's a lot of like different events happening in May all around the community. So definitely if you have an event, please share with us. But I know that there's big events from our side coming in. So it's World Lupus Day on May 10th, right? So I stuck Advocacy Day right in the middle of World Lupus Day and World Fibromyalgia Day. And then here we come, like advocacy.
So that's why. So you have May 10th. So in Mexico, we celebrate Mother's Day, or in Latin America, Mother's Day, May 10th, but it's also Lupus Awareness Day. But yes, we'll have that little hump. So it'll bring us over. We'll start with lupus. We'll advocate for fibromyalgia, and then we'll celebrate fibromyalgia and raise more awareness. And then after that, we'll gearing up. We'll give you 2 days off, and then on May 15th, you can join us for a wellness event, which will help us recover from the couple days of busy days that we're going to be doing in May. So May 15th is going to be our first annual Looms For Lupus first annual wellness event, and it is going to give you a lot of opportunities to share with the community. It's for the lupus community, the fibromyalgia community, and it's also for mental health. So it's the three things that we need to get together. And I think it's pretty amazing to be able to see everything that's going on in May. And hopefully you'll start hearing about other things that we're going to be working on with other people in our communities in the month of May. So yeah, it's going to be pretty busy.
I know. And we have our pajama party, our fibromyalgia pajama walk that we're starting to like make sure we organize. And then before May, we worked on this fantastic project with Crystal. I also see her here from the Fibromyalgia Pain Chronicles and the Veteran Voices of Fibromyalgia. So she did a great interview with 3 advocates. They're going to share with us. So that's why I said, don't feel like you have to do this on your own, because you don't. So these videos are fantastic. It'll get you ready to go. There's a lot of good information here that she shares, and we're going to have more of that too. It's inspired us to do more videos like this on other things that we can do to get people more involved in advocacy, and you'll see how these journeys evolved and what these people went through to get to what they need, and that your voice does matter, and you'll hear it all throughout these videos. So thank you, Crystal, for bringing those advocates together to share with our community, and let's get inspired and ready for all that we have upcoming. Because it's definitely, we have some good stuff. This is good, and it's gonna be a good month. We have to keep up with our wellness and our health, so that's why I'm excited for your wellness event. But you know, I can't wait. So I think everyone out there, please definitely reach out to all of us to get involved.
Because we are in this together. You know, we can't do it alone. And, you know, yes, you know, definitely we are stronger together. And I think we just need to just remember that we're not alone, and you know, we don't have to do this alone. So it's pretty amazing. I know we have a couple of, I think we have my cousin from Ohio. He is saying hola, so hola, buenos dias. You know, we're also, if you guys speak Spanish, you know, we do speak Spanish. We're bilingual. Just because you don't have, well, I should say it in Spanish. Para las personas que hablan español, que necesitan o quieren también contribuir en los movimientos que estamos haciendo para el mes de mayo, notifíquenos y nosotros les ayudaremos a llenar toda la aplicación o a llenar o a darles el formato para la proclamación, de donde la ciudad declara el mes de mayo como el mes de concientización sobre lupus o sobre fibromialgia o sobre la salud mental. Son condiciones que a veces no hablamos mucho porque en nuestra cultura no nos gusta hablar de los problemas, pero quiero decirles de que no están solos, y si necesitan ayuda haciéndolo, si no saben qué formato es ni cómo hacer las cosas, llámenos y nosotros les ayudamos. So I just had to say that in Spanish, because just in case someone that is following wanted to hear that in Spanish and wants to do this in their city, which we're probably going to make my cousin. So, primo, te vamos a mandar la información y te vamos a ayudar para que declaren en la ciudad de Ohio, de donde vives, como el mes de lupus y de fibromialgia y de salud mental en tu ciudad. So I'm just, I kind of pointed out to my cousin, like, we're going to help you, and you're going to request a proclamation in your city in Ohio. I don't know what city he's from exactly, but in his city, so he's going to do it for us. So I just called him out on it. So.
Well, Ohio is going to bring it then. I mean, we have definitely Crystal too. So a big team over there, and then we have the West Coast, the East Coast. So we need to fill it in. Like, we really have to. I want to see all 50 states covered. So friends in Alaska and Hawaii, please chime in. I think we need to know what's going on.
Oh my gosh. Of course, Hawaii. We're going to get Hawaii. Where's Malaka? We're going to call her. So there is one, Lupus and Sjogren's. I can never say Sjogren. Can you say it, sister?
Sjogren's.
I can never say it. It's like a tongue twister in my mouth. But she leads an organization in Hawaii. So I am going to call her and have her join the party. And she's in Hawaii. I don't know anyone in Alaska.
We'll find people. Hello, share this with all your friends, everyone out there. Let's find some of our Alaska representatives, because we need them involved. We need the other states involved. I'm trying to figure out. So if you want to be a representative of your state, let us know, because we're definitely in need, and we have the team leaders we want to build on. So it's good. And look, Crystal's working on our proclamation. So that's exciting. Awesome. Obtaining city proclamation. So see, this is where we come together. We celebrate everything that's going on. And I know it's tough when we talk about what we've been diagnosed with, because I know people say, like, you guys are celebrating. It's weird. But we're finding purpose in this diagnosis, and through all of the pain that we've endured, we find our purpose. And I want to just make sure to always highlight everyone that we're working with and be inspired by the work from Looms For Lupus, Crystal, all these other organizations that we highlight. I mean, we talked to Jenna, who's working on advocacy work for MS. We have Tony, also an MS warrior. So there's so many people out there. They're just doing incredible work. So reach out, and you can be involved with us. And there's so many avenues of sharing what your voice really matters to the community, and you can create change. And we need to come together to create that change. So I appreciate
Definitely.
my teammates here.
Yes. It's just so exciting. Again, we can't do it without you guys. So let's get those 50 states going. Let's get it. Let's get the party started, right? And
Yes,
we
the
need to start doing
advocacy
it now.
party. Well, Crystal's rallying in Texas. Good. Texas is a big state. We have to cover it all. So we got California pretty good. I'm excited. So
Yes,
reach you.
California. We have family members in Arizona, so we're going to get Arizona as well. If not, we will just call Barbie. She'll make it happen.
A shout out. Oh, and definitely. But thank you everyone for tuning in. Please continue to create a vision of community. And for all the advocates out there, please do the same. Reach out to us because this is our big goal, is really digging in and building community like on a higher level of what we're doing, and also local levels and how we can support you. Because I just find it so important to support organizations that are also working on the local level and getting those services directly to our community. So thank you, everyone. We will see you next Friday.
Yes, next Friday. Talk to you soon.
Bye.